Hypertension and stroke, 6 warning signs. You can't ignore. Do you want to know what causes thousands of people each year to pass away in just a few minutes, without time to call loved ones or say a final goodbye? The answer may lie in something seemingly invisible but silently creeping within the bodies of millions: hypertension. And behind it lies a terrifying threat: stroke. Stroke is the second leading cause of death worldwide, and hypertension is the primary culprit behind most stroke cases. According to the World Health Organization, WHO, up to 51% of stroke cases are due to poorly controlled hypertension. Many people are unaware they have the condition until a catastrophe strikes, and by then, any intervention may already be too late. Do you want to know the warning signs your body is desperately trying to send as a wake-up call? Below are the first signs that many older adults often overlook. First sign: persistent headaches, especially in the morning. Don't dismiss those dull, nagging pains in the back of your head or temples. These occur when blood pressure spikes suddenly, causing abnormal stretching of brain blood vessels and putting immense pressure on pain receptors. A Harvard University study found that patients with frequent morning headaches are 3 times more likely to have hypertension than the general population. Second sign: dizziness, or a spinning sensation, as if the world is turning upside down. This happens when blood flow to the brain is disrupted due to sudden changes in vascular pressure, reducing oxygen to brain cells. This is an urgent warning to heed, as the American Stroke Association notes that 60% of stroke patients experienced dizziness days to weeks beforehand. Third sign: sudden blurry vision, seeing double, or feeling like a foggy veil is covering your eyes. The tiny blood vessels in the retina are highly sensitive to blood pressure changes, so any visual abnormalities warrant immediate attention. The journal Ophthalmology has warned that eye symptoms may be the earliest indicators of malignant hypertension. Fourth sign: transient numbness or paralysis on one side of the face, arms, or legs. This may last a few minutes to hours before resolving, leading many to dismiss it. However, this is a hallmark of a transient ischemic attack, TIA, the earliest warning of an impending major stroke. Studies show that about 15% of TIA patients will suffer a full stroke within 3 months if untreated. Fifth sign: difficulty speaking clearly, slurring, or inability to express thoughts. When the brain's language centers lack blood flow, speech is immediately affected. If this occurs, do not delay. Seeking emergency care within the golden window, 3 to 4 hours, is critical for survival. Sixth sign: irregular heartbeat, rapid pulse, shortness of breath, or unexplained anxiety. These are not just heart-related symptoms, but also reflect nervous system stress and elevated blood pressure straining the circulatory system. According to the U.S. Centers for Disease Control and Prevention, CDC, individuals with uncontrolled irregular heart rhythms face a 5-fold higher stroke risk. A study published in The Lancet found that for every 10 mmHg increase in systolic blood pressure, the risk of stroke rises by approximately 30%. This means that even a slight but prolonged increase in blood pressure exponentially heightens stroke risk. Do you want to know why strokes caused by hypertension are so dangerous? When blood pressure spikes, brain blood vessels can rupture at any moment. Blood flooding into brain tissue causes irreversible damage, and within minutes, brain cells begin to die. If not treated within the golden window, about 3 to 4 hours, the consequences are severe: paralysis, memory loss, cognitive impairment, or even death. However, the good news is you don't have to live in fear. There are highly effective, scientifically proven measures to control blood pressure and prevent stroke. Monitor blood pressure regularly. Measure your blood pressure at least twice daily in the morning and evening. Use a home electronic blood pressure monitor, keep a log of readings, and consult a doctor if abnormalities arise. Reduce salt intake. The WHO recommends no more than 5 g of salt per day. Older adults should limit salty dishes, pickled foods, and concentrated fish sauce to avoid water retention and blood pressure spikes. Increase potassium intake. Potassium helps excrete sodium through the kidneys and relaxes blood vessels. Sources include bananas, sweet potatoes, beans, avocados, and leafy greens. Stay active. Brisk walking for 30 minutes daily or practicing Tai Chi, yoga, or Qigong improves blood vessel elasticity and stabilizes blood pressure. Lose weight if overweight. Each kilogram lost can lower systolic blood pressure by 1 to 2 mmHg. Manage stress and sleep well. Stress triggers adrenaline, which constricts blood vessels and raises blood pressure. Aim for 7 to 8 hours of sleep nightly and practice deep breathing, meditation, or relaxing music. One surprising fact many don't know, even after a mild stroke, transient ischemic attack, controlling blood pressure effectively from that point can reduce the risk of recurrence by up to 80%, according to the American Heart Association. Additionally, Japanese studies show that a diet rich in vegetables, seafood, whole grains, and green tea can soften blood vessel walls and significantly lower blood pressure after 12 weeks. This traditional Japanese lifestyle contributes to their status as the nation with the lowest stroke rates globally. Don't wait for a catastrophe to act. In the next section, you'll learn about common mistakes older adults make when treating hypertension and how to overcome them effectively. Stay tuned for the final part, and don't forget to subscribe to the Senior Health Vista channel for valuable daily health insights. Do you want to know why many people, despite taking medication daily, still have unstable blood pressure? Or why some still suffer strokes despite treatment? The answer lies in 5 common but dangerous mistakes many older adults unknowingly make. Mistake 1. Only taking medication when feeling unwell. Many believe blood pressure only needs control when symptoms appear, so they skip doses when feeling fine. However, hypertension is called the silent killer because it often lacks clear symptoms. Intermittent medication causes blood pressure fluctuations, the highest risk factor for stroke, per the American Heart Association. Mistake 2. Self-adjusting medication doses based on feelings. Some take 2 pills if blood pressure feels high or half a pill when feeling better. This is extremely dangerous as hypertension drugs require consistent doctor-prescribed doses to avoid blood pressure shocks or side effects. Mistake 3. Not combining lifestyle changes. Medication addresses only part of the issue. Root causes like high-salt diets, inactivity, obesity, or poor sleep persist if unchanged. European studies show that those relying solely on drugs without lifestyle changes face a 2.5 times higher stroke risk than those combining medication with healthy habits. Mistake 4. Trusting unverified folk remedies. Drinking coconut water every morning, eating raw garlic, or applying hot salt packs are popular but lack strong scientific backing. Some may even cause adverse effects if misused. Always consult a specialist and rely on trusted medical guidelines. Mistake 5. Not monitoring blood pressure regularly or following up. Many only check blood pressure during periodic doctor visits or when dizzy. Daily home monitoring detects small fluctuations early, allowing timely adjustments to prevent major events. Effective blood pressure control and stroke prevention require not just proper medication, but also synchronized lifestyle changes. Here are 10 science-backed daily habits to adopt. Drink warm water each morning upon waking to improve circulation and flush toxins. Eat a full breakfast and never skip meals to stabilize blood sugar and morning blood pressure. Reduce salt by seasoning lightly and avoiding processed foods. Consume fiber-rich foods, greens, fruits, seafood, and whole grains. Maintain an ideal weight with a BMI of 18.5 to 24.9. Practice deep breathing for 5 minutes morning and evening to lower blood pressure quickly. Sleep 7 to 8 hours, avoid staying up late, and limit nighttime electronic device use. Avoid smoking and limit alcohol, both of which harden blood vessels and strain the heart. Get health checkups every 3 to 6 months, especially if you have diabetes, high cholesterol, or heart conditions. Stay relaxed, maintain a positive mindset, and avoid prolonged stress. A University of Oxford study found that older adults who walk 30 minutes daily, reduce salt, and control weight can lower their stroke risk by up to 40% within 5 years. The key takeaway: stroke is not a sudden death, but the cumulative result of years of unhealthy habits. Every small change today is a step away from tomorrow's risks. Here's a surprising detail few know. Even after a stroke, adhering to 3 principles, controlling blood pressure, maintaining a healthy lifestyle, and attending regular checkups, can lead to functional recovery, reduced recurrence risk, and many more healthy years. This is evidenced by over 60,000 patients in Germany's cardiovascular rehabilitation program, where stroke mortality dropped by over 70% through these combined efforts. To further reduce stroke risk, avoiding mistakes isn't enough. Proactive, science-backed strategies are essential. Here are 10 comprehensive solutions to sustainably control blood pressure and protect brain blood vessels. Adopt the DASH diet. Dietary approaches to stop hypertension. Recommended by the U.S. National Heart, Lung, and Blood Institute, DASH emphasizes greens, fruits, low-fat dairy, whole grains, and foods rich in potassium, calcium, and magnesium while limiting salt, sugar, and saturated fats. An 8-week study showed DASH followers reduced systolic blood pressure by an average of 11 mmHg. Consume natural flavonoids. Flavonoids relax blood vessels, reduce inflammation, and act as antioxidants. Found in pure cocoa, blueberries, strawberries, apples, green tea, garlic, and red onions, daily flavonoid intake cuts stroke risk by 10%, per the American Journal of Clinical Nutrition. Boost gut-friendly bacteria, probiotics. Recent studies link gut microbiota to blood pressure. Probiotics regulate salt absorption, reduce inflammation, and support blood vessel health. Sources include yogurt, kefir, kimchi, and naturally fermented pickles. Relax with music therapy. A Japanese study found that listening to soothing music for 30 minutes daily with deep breathing lowers blood pressure by 6 to 10 mmHg. Choose instrumental tracks, sounds of streams, birds, or gentle piano. Increase natural nitric oxide. This compound naturally relaxes blood vessels. Boost it with beets, watercress, spinach, and regular exercise. A University of Exeter study showed that elderly participants drinking beet juice for 2 weeks significantly lowered blood pressure. Prioritize deep, timely sleep. A large University of Chicago study found that sleeping less than 6 hours nightly increases hypertension risk by 37%. Deep sleep allows blood pressure to naturally drop, letting blood vessels rest and recover. Monitor CRP, C-reactive protein levels. High CRP indicates blood vessel damage and inflammation, a precursor to stroke. Regular CRP tests are crucial if you have hypertension, diabetes, or obesity to adjust diet and exercise promptly. Practice simple isometric exercises. Static exercises like squeezing a ball for 2 minutes, relaxing, and repeating 4 times per hand lower blood pressure quickly. A Canadian study showed a 10 mmHg drop in systolic blood pressure after 5 weeks. Be proactive in self-care. Create a weekly health plan, set medication reminders, schedule checkups, and note daily feelings. Those who track their health are 40% more likely to adhere to treatment, per UK statistics. Find purpose in life. A Harvard study found that those with clear life goals, like caring for grandchildren, volunteering, or learning a language, have lower blood pressure and a 23% reduced stroke risk. Joy and motivation are essential medicines. Finally, a game-changing insight. It was once believed that the brain couldn't recover after a stroke, but Stanford University research proves the brain can restructure neuroplasticity with proper stimulation through language, movement, and nutrition. This means you can retrain damaged brain areas to restore function. You don't need to be a doctor to value health or be perfect to start changing. All you need is determination and small, consistent steps repeated daily. Act today, because every small action is a step towards safety, health, and dignity in old age. Share this article with those quietly living with hypertension. And don't forget to subscribe to Senior Health Vista for more valuable knowledge to help you and your loved ones stay healthy, steer clear of strokes, and thrive every day.